How's it going? This is Felix Marquez from Orlando Medical Institute. I'm here to bring some quick tips on how to utilize the Bougie. As I see people intubate, I see that they struggle with it. So I want to talk a little bit about it. A lot of people like to put the direct tube in. I like to think of the direct tube going into the airway as a basketball going into the hoop. And when you put a basketball into a hoop, it's almost a perfect fit. So what I like to do is take out the basketball and use the Bougie. I consider the Bougie the actual baseball going into a hoop. It's easier to get a baseball in a hoop than a basketball into a hoop. And the Bougie is the baseball and the airway is the hoop. So putting the baseball into the hoop is easier than putting the basketball into the hoop. So let me talk a little bit about the Bougie itself. As you see, we have two ends. We got a bent tip side and then we have a straight tip side. So the bent tip side is the tip that's actually going to go into the airway. As you put that into the airway, you actually pop the crike rings. And when you pop it, the trach ring, the trachea rings, it creates a vibration on the tube. That's how you know you're in. You won't get that if you're in the esophagus. Okay, so a lot of people, what they do, a lot of people, what I've seen is people will go in with their blade and their handle and they'll pass their tube, their Bougie. Once they pass their Bougie, they run their tube, which is actually inappropriate. It's not the right way to do it. Why? What do we tell you when you put an ET tube in? You need to visualize the tube passing. I can't visualize the tube passing if I'm not in the airway. So I really don't know if this tube's going in or not. So the way I like to do it is, one, I take the straight tip, not the bent tip, the straight tip, and I place it into my tube. Now, what's the proper tube to size? What's the proper standardized or default tube you should utilize? You should utilize nothing smaller than an 8.0. The 8.0 should be your smallest tube you grab. Yes, I said 8.0. An 8.0 can go in a small female as well as a male. Most of the airways can fit an 8.0 perfectly fine. So that should be your default tube, not the 7 to 7.5. Reason why is when you put these patients onto an adult ventilator, the pressures and the settings that are set on a ventilator creates a lot of distal pressure if it's anything less than an 8.0 tube. So how much air do we inflate into your syringe, into your cuff? It should be enough air to pillow this. So whether it be 10 cc's or whether it be 2 cc's, if I have a tight fit ET tube, I'll probably only put 2, 3, 4 cc's. Anything more than that, you're actually going to stretch the tissue of the trachea, creating severe damage and tearing of the tissue, which eventually is going to swell up and close off the airway. So put enough air to pillow this cuff. So here we go. So I'm going to take my Bougie. I'm actually going to insert it with the straight tip from the bottom. I take that tip, I put it into the Murphy's eye, just the tip. As you can see, I put the tip right into the Murphy's eye. I don't want it long, I want it nice and short, okay, very short. Now, I allow the Bougie to actually hold my ET tube and the Murphy's eye to hold the Bougie. I want it long, I make it long. I want it short, I can make it short, so I could adjust it. I hold my tube up nice and high. I grab my ET, my laryngoscope blade and handle, and now I'm going to go ahead, visualizing it. I pass my Bougie, automatically pops out, and I continue passing my tube. So I could visualizing passing the tube. Once again, I'll do it one more time. Then you take out the Bougie. I like to cover the top so blood doesn't splat and put blood or fluid onto my partners or anybody standing around the patient. So one more time. I would take my ET tube. I would stick it in the bottom, the straight side. Put it right into the Murphy's eye, just the tip. Stretch it out, grab my blade and handle, I visualize it, I pass the ET, I grab it, I push my tube in, take out my blade, take out my tube, hold my tube, see where I'm at the teeth, and then I will inflate my cuff, and then I will ventilate. As you can see, I'm in the lungs.